Okay. All right. Thanks everyone for joining us tonight. My name is Taylor Danbury, and I'm the Health Professions Coordinator here at Northwest Missouri AHEC. We have tonight Susan McMillan. She's the Surgical Tech Instructor and Clinical Coordinator with North Central Missouri College. She is going to tell us a little bit about their surgical technology program and answer a few questions that we have. So thank you all for joining us. This is our first virtual career chat of the school year for 23-24. So if you would like to pull this up again, if you've forgotten and you're not able to join us live or you're not joining us live, we will have this saved on our website at Northwest or nwmoahec.org under our news and events, and then you'll see the career chat link. So it will be saved there for the rest of the school year. So we'll go ahead and get started. Again, thank you, Susan, for joining us. I know you probably have had a long day, so we appreciate it. All right, so we'll go ahead and get started here with question number 1. So what is your job description, Susan?
As a surgical technologist, you work closely with surgeons and anesthesiologists and nurses in a hospital operating room or outpatient surgery center. You prepare the operating room for surgery, which means you get the equipment. You got to make sure everything works properly, that everything's clean, the bed's in the right spot, everything's stored correctly. Then you go get your supplies and instrumentation, and you set all of that up sterilely. And then during the surgery, you assist the surgeon with holding retractors, passing instrumentation, and that type of thing.
Okay, perfect. So it's a pretty important role. You're right there next to the surgeons the entire time.
Yes.
Okay, great. Why did you decide to go into this profession?
I always knew I wanted to do something in healthcare or in the medical field. I was a firefighter in EMS for 10 years prior to going into surgical technology. I wanted to go back to school, but I didn't really want to be a nurse as much. I'm like, I want to do something in the hospital, but that just doesn't seem like what I want to do. And I worked with a girl that she was going to school for surgical technology, and she told me about it. And I immediately, within the same week, went down to the school and asked about their program and enrolled, because I'm like, this is what I need to do. It's still a medical field, but it's a totally different type of patient interaction. And I'm kind of an adrenaline junkie, so it was right up my alley of what I wanted to do.
Good. I'm sure you see quite a bit of different things come in that operating room.
Oh yes, lots of different things.
Yeah. So you just talked a little bit about your background, but have you had any previous careers or backgrounds in healthcare prior to this besides the EMT?
Nope. I was a firefighter for 10 years. And so I said I always wanted to see what happened after we dropped them off at the hospital. And so then I went into surgery, and then I got to see the other side of it. But other than that, I had not had any medical experience.
Okay. Interesting. What soft skills would you need for this profession? Do you have much like patient interaction or communication with patients?
It's not, the soft skills you need for this job is a little bit different. You don't have a lot of patient interaction. It's very limited, and then they're anesthetized shortly after they come into the room. So, and they don't remember that. I mean, you interact with them some, but the soft skills is more, you have to be able to work under stressful or emergency situations. You may be doing surgery that's scheduled or elective surgery, but you may be doing an emergency case or something may go wrong. You have to be able to act quickly and accurately, think on your feet, critical thinking skills. Even if things are going well, what does the surgeon need next? How can I best help the patient? You have to work well with other people. It's definitely a team effort in the operating room, all the way from the time they're walking to the hospital doors until they're released. So many people are involved in that patient care for that surgery. You have to have manual dexterity. You have to be able to use both hands, right and left, grabbing things, handing things over. You have to be able to stand in one spot for a very long time. Communication skills, you have to be able to listen and communicate what you need to the circulator, the nurse, or the anesthesia, or the surgeon. So it requires good communication skills. And you have to have empathy, because even though this is a job that we do all the time, and it may be, just another surgery, I've done 10 of these today, that is that patient's worst day of their life most of the time, or they're very scared. It may be a normal run-of-the-mill surgery for you, but they're very scared. It's their child, it's their loved one. So you have to have a lot of empathy. But you don't have a lot of interaction with patients and their families.
That makes sense. I never thought about that. Manual, you said manual dexterity. Uh,
Yes.
yeah, I didn't really think of that before. So do different surgeons, they have their likeness on which side of the operating bed they'd like to be on? So is that why you have to use both hands or?
No, it all depends on the what part of the body you're working on.
Oh,
Because they
okay.
also have to have the dexterity. Because if you're depending on where you're working on, how they have to reach around and where you can stand according to that. So it's all, there's so many different types of surgeries you may be doing that I always say I can do just as much things with my left hand as my right hand. We tell our students that too. You get very good at doing things because if you're holding a retractor with your dominant hand and you have to pass stuff with your other hand, you just learn how to do it very quickly.
I'm sure. I'm sure. So were you better with one hand or the other before you took on this career? Or were you?
Maybe luckily I was very ambidextrous beforehand. So I had I see where students struggle. So we do different exercises to show them how to use their left hand. Like we send a clamp home with them and make them practice opening and closing it with their non-dominant hand and that type of thing. So usually by the time they're out of school, they have some practice in that.
That's good. That's good. That's something I didn't ever think of before, but you definitely would need that skill now that you think about it. So nice, nice. So I know we kind of talked about your typical day, but from start to finish, really, how your day starts off, how would you describe a typical day in your career, someone in this career field starting out?
So a typical day, if you worked in a hospital, you would go in, clock in, you would go into the locker room, put on your scrubs and your bouffant cap that covers your hair, and then you go to the OR suite and you look at your assignment for the day and see which surgery you're in. And then you go in your room, like we said before, and set it up. You check all your equipment, make sure everything's clean, you wipe down your room, then you go get your case cart for whatever case you're getting ready to do. And then you would have to open all your supplies, scrub in, which means when you scrub your hands, get on your sterile gown and gloves. You would do the procedure with the surgeon. Then you would clean up the room and do the same thing over and over and over again till the end of your shift.
Okay. Okay. About how many surgeries are there a day?
Mosaic, I want to say 40 to 60 a day, but I don't quote me. I'm not sure. I
Yeah.
mean, and it depends on how long of a surgery you do. You know, some surgeries are a lot faster than others, but I mean, yeah, you can do quite a few in one day. If you're doing like ENT, there's a very quick moving, you could do 10 of those. Or you might
Wow.
be in a really long case and only do 2 or 3. So it all varies, but it's
Yeah.
definitely very fast pace and what they call turnover. Once you're done with one surgery, you have to clean the room and start the next one. It's a very fast pace in that too.
Wow. Wow. I see now how you said you're kind of an adrenaline junkie, how this would be a good career because one patient after another, like you said.
Yeah.
So,
I spent a lot of time working night shift and weekend shift. And so you get any emergency cases that came through the ER that would have to, like, that weren't scheduled. So I got a lot of practice doing those cases.
oh, I'm sure that would be great practice. I'm sure.
Yeah.
Yeah. So what other departments do surgical techs work with?
So when you first come into the hospital, depending on if it's an elective surgery, which means it's a planned surgery, like you know you're going to have it, or if it's something that's an emergency, you come through the ER. So you would have the ER or the admitting desk that bring you in, check you out, so you have the floor for that. During surgery, like beforehand, it's called same day care unit. They're the one that check you in for surgery, get you prepped and ready, put in all your information, and then they take you, then you go to the operating room from there. And after that, you go to either ICU or PACU. PACU is post anesthesia care unit. That's where they monitor you after surgery, make sure you're doing okay. And you either get to go home or go to the floor and stay. You also might have to work with pathology. They send a specimen off. You might have to go get labs. You might have to work with blood bank. And so there's lots of different radiology. A lot of times they bring radiology into the operating room and do x-rays during surgery.
Okay. Okay. And then after you're done with the surgery, are you charting as well on the patient? Do surgical techs?
Surgical techs do not normally chart. This RN is called a circulator, the register. They do the charting and anesthesia and the surgeon. So
Okay.
surgical techs do not have to chart.
Okay.
So another plus
Yeah,
on
that
my
is.
personally, I think.
Yes, that is definitely a plus. I think so.
Yeah.
Yeah. So, what is the education and training needed to become a surgical tech?
A few years ago, nationwide, it used to be a certificate program, but nationwide they changed it to go to associate's degree program. So right now, North Central Missouri College offers an associate degree in surgical technology. This takes 2 years if you count all of the things for the degree. So that includes like your gen eds, your history, your speech, your math, your English. The actual surgical technology program and the classes that contain that is an 11-month program. We start in June. It's 3 semesters long and we finish in May. So you will, in June, we take like pharmacology, care of the surgical patients, intro to surgical technology, and central services classes. And then in the fall, we take fundamentals of surgical technology and procedures. And then all those have labs. You do 12 hours of lab a week. And then in January, you do a procedures class, a capstone class, and clinical. So 3 days a week, you actually go to a hospital and you have a preceptor and you do surgeries 3 days a week.
Oh, nice. So you get those hands-on experiences and everything.
And
Like that.
then when you graduate from an accredited program, you sit for the certification test, which is the Certified Surgical Technology exam.
Okay. Great. And when they're doing the lab work, are they there on campus as well? That's all
Yes,
on
so
campus?
the
Okay.
labs, we do labs in the summer and in the fall. And our new facility in Savannah, we have all state-of-the-art labs, brand new. They've made for it. It's
Yeah.
very nice. If you haven't seen them yet, they're great. But we do so we teach them all the skills from opening back table, opening sterile supplies, instruments, gowning and gloving, scrubbing, and they do the mock setups over and over and over again. And then we do mock surgeries, and they practice passing to it, like I'm the surgeon and they're the tech, and they practice draping and prepping the patient, catheters, dressings, everything from start to finish of the patient.
Oh, that's so nice. So they get to practice all of that before they even go out to clinicals.
Yep. Yeah.
Nice. Nice. That's wonderful. Yes, I was able to come to the open house and it is a beautiful facility.
It is.
It's
It is
gorgeous.
so I can't even go. It's so nice. Like it's very, I don't know the word, state-of-the-art technology to where when they go into a hospital, they're going to be prepared because they've seen the equipment, they've seen the setups. We have the ability to do laparoscopic surgery on a mannequin so that they can actually run the cameras and the scopes and see what they're doing and learn to practice that with their hands. Because that's also another skill, is being able to run a camera and an instrument at the same time. So they learn all of those things in lab. And even though they have a preceptor at clinicals, they're more prepared and they feel comfortable in the setting.
Definitely, definitely. And that's you said Savannah, and that's in both locations?
No, just Savannah, only in
Just
Savannah.
In Savannah? Great. Yeah, that's a huge benefit, I'm sure, before going into clinicals to have that experience.
And we are a smaller class. I think, sorry, I'm skipping ahead. There is a
That's okay.
question about it. But we only accept 15 students max to our program. And with 2 instructors, that allowed the one-on-one instruction they get in lab time is invaluable. And we do that has to do with accreditation in our clinical sites, but also our accreditators say we can't have more than 10 students per instructor during lab. So I will, even if there's 15, we'll do 2 separate ones. So they always get that attention they need during lab time to get that one-on-one instruction.
Yeah, that's very important, I'm sure, and beneficial. That would be one of the reasons to choose North Central, I would say.
Yes, I feel it's very, they get a lot of instruction and a lot of hands-on experience.
Mm-hmm. That's great. Do you guys offer tours for students that are
Yes.
deciding on? Okay, great. Wonderful.
Yes. Yep. You can contact either of us anytime, or Sue Nichols, and we can get that set up. And if they want to tour while we're having class, and we can kind of show them things, or we're more than happy to give anyone a tour anytime they'd like.
Okay, great. Great. I'm sure some students would love that. So we'll pass that along. Okay, so we talked about the education and training. Are there different types or levels of surgical techs?
Yeah, they have a surgical tech 1 and 2, and that varies on your experience and the things you can do. The most common advancement is a surgical first assistant. So it's a different role than a surgical tech. It's usually a surgical tech and they go on to first assist school. They actually work more closely with the surgeon. They can suture, they maybe will give, they hold retractors, and they have more expertise and skill than a surgical tech does, and they work more closely.
Okay, perfect. But that's not a training that is offered at North Central? That's something that is
No,
trained more on the job or?
they do some on the job and they will send you to different courses. There's not a first assist program locally that I know of.
Okay. Okay. Good to know. Good to know. Is there room for advancement in this career? I know that kind of boggles off that question before, but do you see any surgical techs maybe move up the ladder?
Yes, very much so. Like I said, you can be a first assist. Also, there is some some people go on to they go on to nursing school also because they're called circulating nurses that are the nurses in the OR, but they can also have scrub nurses and they can do the surgical tech job as also the circulator job. So they can do both. So that is an advancement too, along with first assist.
Okay, so you see a lot of students maybe start out as surgical techs and then go on to nursing school.
Yes.
Okay.
And they can go on to nursing school and work in the operating room still.
Okay. And they're called the scrub nurses, you said?
Yeah.
Scrub nurses. Awesome. That's wonderful. And then I know we talked about the classes and clinical training and what they're like. So we kind of went into detail on that. Is there anything else that you kind of wanted to add in regards?
No, we follow the ARCS TSA guidelines and they have how many they have to do 120 specific cases during clinicals, and I track that every week to make sure they're getting the right cases and which clinical site they're doing. So it is they can't just go do whatever they want. There's very specific cases to get them the right experience so that they're ready when they're finished, when they graduate, so they're employable and ready to start the job.
Okay. And then what clinical sites do you send students to?
Right now, we send them to Mosaic in St. Joe,
Okay.
St. Joseph Outpatient Surgery Center, Mosaic in Maryville, Atchison, which is called Amberwell, I think now is the name of Atchison Hospital, Cameron Regional Medical Center, Liberty Hospital, North Kansas City Hospital, and we have clinical affiliations with Truman and Research, but we have not had to use them yet because we have lower numbers.
Okay. Great. So quite a few options if needed
Yes.
to go multiple
Yes.
places.
And
Wonderful.
we try, depending on, we can't always guarantee where you'll end up where you want, but we try to talk to the student about what their expectations are. Where do you live? Where do you want to work? Where do you see yourself? You know, and make that, because we want them to, and where do you fit in well? And how do you do at clinicals? Because we want them to have a positive clinical experience, but also we want to set them up for success in getting a job. So if they really want to work at Mosaic, we're going to make sure to try to send them out a clinical rotation there for a while so they can get a feel, they can see them, they can see that you do. But when it comes time for interviews, they can put a face to the name.
Yeah, that's great. But if they live closer to one of the other clinics
Yeah,
or
we've had
sites,
students that live in Kansas City and they say, I really want to work at North Kansas City. And so, okay, we're going to try to get you a clinical site at North Kansas City because that's where you want to end up.
yeah, that's a great benefit.
Yes.
Yeah, it's wonderful that you have so many
Again, another
affiliates.
benefit of having smaller class sizes.
Yes, definitely, definitely. It'd be tough if there were a few more kids in there. So, all right. What type of students are you looking for this program to apply?
Um, we need students. I talked about some of the soft skills, but you have to be able to take and follow directions under stressful emergency situations, take constructive criticism, multitask, have attention to detail and organization. You have to work as part of a team. You have to have a stable temperament. It's a stressful environment some days. And the surgeons can be stressed out, and everyone's working towards a common goal. So you have to be a team player. You have to be responsible. You have to be caring. I tell everyone, it doesn't matter which job you have in the medical field. If your number one goal is not to help the patient and patient safety, you're in the wrong business. So always stand up for the patient. We talk a lot about surgical conscience. It's doing the right thing right, even when no one's looking, because at the end of the day, we're doing this all for the patient. What if it was your loved one that you're having surgery on? So you have to be able to have that. But I feel like that goes for any medical field. People get into healthcare because they want to help people. And that's generally, they already know that when they come in. So we just reiterate that you have to have a strong surgical conscience of doing the right thing.
Yeah, yeah, I totally agree with that for sure. And then to go along with that, do they need to already have their prerequisites completed before
So
applying?
yeah, Our application deadline's March 1st, so they need to have the prereqs. If they're enrolled in some in that spring semester, they can go ahead and apply contingent on them passing that spring semester, because our classes start in June, so they can be enrolled in them, but it is contingent. If they do not pass, then they cannot be accepted into the program. But they can be
Okay.
finishing up those prerequisites.
Okay, great. How early can they start applying for this
I
next
think it's
class?
open all the time. So like even now it's open. This
Wonderful.
is our first year we're doing a online application. And if you go to North Central Missouri College website and go to the surgical technology program, you can click on the application.
Great. That's nice that it's open
Yes.
continuously.
Yeah.
Mhm. That's wonderful. Okay. How many students will you be accepting? I think you said, was it 15 or 20 max?
15's our max. And like I said, that is through our accreditation of how many we can accept. And that is North Central is known for its smaller class sizes, and it's a smaller school, which I personally love as a teacher and as a parent who has kids that have went there. It's just very nice to have a smaller school. But we accept 15 into our program, and that's a very manageable number. There's 2 instructors right now. It's manageable for clinicals. It guarantees you'll have a clinical site. So we won't have an influx of, if we had 50 students, we wouldn't have enough clinical sites to send them to. Yeah.
Makes perfect sense. Yeah, I agree with that as a parent as well. And working in healthcare, the perfect number, I'm sure. All right. Is there anything else that you'd like to add about the program or about North Central?
Yeah, a couple things. So right now there's a shortage of surgical technologists. So there's always openings. We have seen our students are very successful in getting hired for these jobs right after graduation. They're expected to be favorable for the numbers of surgeries increased, so have a job. And a lot of places right now are giving sign-on bonuses, tuition reimbursement, all kinds of things. So it's a stable job to get into with a lot of benefits.
Definitely. We've been going into the local schools and local high schools, and I know that there's quite a few students that are interested and they weren't
Great.
before. So yes, so I'm sure they'll be contacting you, maybe be watching this afterwards, the replay. So we're excited to hear that it's open continuously, the application process, and that you guys are open to giving tours, because I'm sure a lot of them would love to do that. The campus being right here in Savannah is a big plus too. So
Yes, we're very excited about that. Me and my coworker, Jeremy Wilson, we've built this program together, and we absolutely love teaching it. So we want to promote it, and we're all about getting more students. So we're very willing to do it. The thing is, a lot of people don't know what surgical technologists are. So we're trying to get the word out, and it is a different career. If you know you want to be in the healthcare, but you don't want to be a nurse, you don't want to be a doctor, you don't want to do radiology, this is another option.
yeah, definitely. And please, if you have any students as well, I think a lot of our students know this, but if this is their first time joining, or if they're coming to you, and they're not sure if they, want to go into this field or not, we offer job shadowing. So if they want to job shadow a surgical tech for a day, then they can contact us and we can set that up too. So
We actually require a job shadow before they can apply
yes, I remember
with
that
you
now.
guys.
So
Yeah.
yes, so
Yeah.
it's 8 hours, correct? Is that one of the requirements?
I can't remember. I can't remember the actual
And
hours.
there's
I'd have to look it up, and they
okay.
have to write a little paper about it. But it is because a lot of people like it, but they've never seen it, and so they go in there, and it's either they're really excited or like, oh, not for me. So it is
Yeah.
one of the very first requirements that they have to do is job shadow.
Perfect, perfect. Well, we love when students come to us and they ask us to job shadow, especially in those fields, because some of them come back and they're so excited because they loved their day, and some of them come back and they'd like to see other areas. So it's a great opportunity to, explore different careers. So we're happy. Please keep sending them to us, and we're more than happy to share this and spread the word about surgical technology. So
Well, we
thank
appreciate that very much, and let us know whatever we can do. We will be at I can't remember. It's like a health career day that we go to every year, and some of the local schools come. We'll be there in October, and we are
Okay.
open to do tours. Just contact us anytime.
Okay, we definitely will. Thank you so much, Susan. We appreciate you joining us, and We will talk to you soon, I'm sure.
All right. Thank you so much.
Thank you. Bye-bye.
Bye.